Welcome to our lesson on referrals. Understanding the role of referrals is critical for those working at the front desk, especially when it comes to scheduling. But there are a few aspects of referrals that can lead to confusion, particularly among those who are new to this position. So let's begin by addressing these potential sources of confusion, starting with how referrals are defined. In day-to-day conversations, the word referral is generally used in one of two scenarios. The first being when someone recommends family or friends to your practice. In other words, they've referred their friends to the practice. The other scenario is when a physician, like a PCP, refers a patient to the dermatologist. This is a more formal process, typically in writing and often accompanied by exam notes, or at least a description of why they need to be seen by the dermatologist. Although yes, these are often described as referrals. It's these, which we're discussing in this lesson. This isn't to say that you can no longer use the word referral in the context of someone referring friends or family to your practice, but just know that, at least with respect to your duties at the front desk, when the word referral is used, this is what we're talking about. So with that clarified, let's talk about the front desk and billing definition of referral. A referral is a written or electronic request from the patient's PCP or occasionally another doctor for the patient to see a specialist, which in our case would be the dermatologist. Some insurance plans, especially HMOs, require referrals before patients can be seen by a specialist. Doing so allows their PCP to essentially act as a gatekeeper. In theory, this can save the insurance company money by having simpler, more straightforward problems more likely to be addressed by the PCP, as opposed to a more costly specialist. But as with just about everything else in medicine, the effectiveness of this strategy is up for debate. Let's go over the stages of the referral workflow. First is recognizing the need for a referral. As we discuss in other lessons, the scheduling process isn't just about making someone an appointment. Instead, a key responsibility when scheduling patients is to identify any requirements established by the patient's insurance before the patient can be seen. Sometimes a simple review of the patient's insurance card confirms that they need to be referred, while other times it's only something we recognize after running an eligibility and benefits check. But no matter how you identify the need, the key is that the need for a referral must be identified. If you've already seen some of the other lessons, you may be tired of hearing us say this, but we'll say it again. If patients whose insurance plan requires a referral are seen without a referral being made, the insurance can, and likely will, deny reimbursement altogether. So always identify those patients whose insurance requires a referral. At the front desk, this is your first and primary responsibility. So once the need has been identified, it's time to request or obtain the referral. Some patients already know that they need to be referred by their PCP if they want to see a dermatologist, so they simply ask their PCP to submit the referral. Other times, patients initiate appointment requests directly with us, and it's patient-initiated appointment requests which we need to be careful with. This can often start with the patient by asking them to confirm whether their primary care provider has already initiated one. If not, either the patient or your clinic may need to request it from the PCP's office. Although once the referral request has been submitted, it's overall mostly a matter of waiting for approval. There are a few details worth noting. First, be sure that some indication has been made within the patient's chart which confirms that a referral is pending. Again, if the patient ends up being seen without having received the referral, your practice can lose hundreds, if not thousands of dollars in reimbursement. So hopefully your practice management system has some sort of safety mechanism or reminder system built in place, which can alert everyone should the patient show up on the day of their appointment and no formal referral has yet been received. And don't forget to document. Until any given referral has been received and formally logged in the patient's chart, always document conversations you've had with the patient about their referral, phone calls you've made with the PCP, etc. If for any reason there are problems later, so far as who has dropped the ball with respect to a referral not being received, notes about the progress, including documentation of calls or other discussions, are going to be needed. Once a referral has been received, it's time to confirm its scope and permissions. Some referrals may only allow for a consultation, while others might authorize both evaluation and treatment. If a referral says, evaluate only, that means that they are authorizing the consultation itself, but not granting permission to perform procedures. As you can imagine, especially in derm, this is worth noting. If for any reason a patient needs a biopsy, or for AKs or other lesions to be frozen, a referral which states evaluate only could result in your practice being denied reimbursement should any procedures be performed during the visit. Fortunately, evaluate-only referrals aren't as common, but they do still happen. On the other hand, the phrase evaluate and treat is the PCP's and insurance's way of saying that treatment, which typically involves procedures, may be performed. However, the reimbursement for any procedures may still be subject to the limits of the patient's coverage. Also pay attention to any references to a specific diagnosis.